giant cell matlab ma'am granuloma. And now look at the others. Is the most common artery abdominal aorta? Now what is the other name of giant cell arteritis? It is temporal arteritis. This means the most common artery is the superficial temporal artery, not the abdominal aorta. What is the most common symptom? यहाँ पे देखो temporal artery मतलब most common symptom is going to be extreme headache in this area, unilateral headache. Most common. What is most specific? Most specific is going to be jaw claudication. Pain in the jaw will be the most specific, but what is the most dangerous once it happens and we are gone? Loss of vision, blindness is going to be the most dangerous. So these are the set of symptoms. And obviously, ma'am, temporal matlab temporal artery, and giant cell matlab I'm going to see what microscopically lots of giant cells. One more thing with giant, what is the age? Patient is also giant. That is, it's going to happen after 50 years of age. It is the most common vasculitis in adults. One question, two questions from surgery and medicine. Biopsy में कितना centimeters का biopsy do you take? So when I take a biopsy, we prefer that I take 3 to 5 centimeters. Many books mention 1 centimeter. The latest guidelines say 3 to 5 centimeters because they are saying that this condition is nodular. It might be seen over here, it might not be seen over here. So if you take 1 centimeter, you will miss it. 3 to 5 centimeters you have to take. And next, what is the treatment? The treatment is that you have to start with steroids. Not just that, you have to start with steroids ASAP. Do not wait for anything. So coming back to the question, is it continuous? No, it is nodular involvement. Patchy nodular involvement. Is it a small arthritis? Of course not. It is a large vessel arthritis or large vessel vasculitis. So now asking you, under large vessel you have TMT, temporal ho gaya. If now they just change the age, giant ki bajai they say patient is less than 50 years and pulseless disease, which means the upper limb pulse is very, very weak. Less than 50 years with weak upper limb pulse, and you know the most common vessel affected in the arch of aorta is going to be very good. Subclavian. All of you have successfully finished the T and T. Sometimes, I'll give you one example. Sometimes what will happen, they will say there is a vasculitis. दोनों patients में ma'am headache can happen. So there's a vasculitis and there is headache and they say it is a large vessel vasculitis. दोनों में headache. What do I select? This T or this T? Look at the age. Above 50 हुआ, mark temporal. Below 50 हुआ, mark Takayasu. If both of them have the same symptoms of headache, go by the दोनों patients में ma'am headache can happen. So there's a vasculitis and there is headache and they say it is a large vessel vasculitis. दोनों में headache है. What do I select? This T or this T? Look at the age. Above 50 हुआ, mark temporal. Below 50 हुआ, mark Takayasu. If both of them have the same symptoms of headache, go by the age in that case. Now let's move on to the next question. For 3 weeks. Okay, there's a suspicion. Of autoimmune vasculitis, and arteriography reveals involvement of thoracic aorta. Which of the following is the suspected part of it? Yes, most of you are right now. Takayasu, because ma'am, jab aorta aega, Takayasu, is the person less than 50 years? Yes, it is. So all of this seems to be falling very much in place. Next question. Which of the following conditions is associated with the vasculitis of the histopathology shown below? I assume everyone has guessed that this is a blood vessel, and in this blood vessel, you have something which is showing you as a pink color band, which is our general path, that is fibrinoid necrosis. Many of you are right. Fibrinoid necrosis and blood vessel, matlab the disease is polyarthritis, not You PYQ everywhere and make your PDF even bulky because whatever I'm go by the age in that case. Now let's move on to the next question for 3 weeks. Okay, there is a teaching you is either very, very important, high yielding potential, or is a PYQ. So मान के चलो this PDF is PYQ PDF and potential PDF. So we will now not waste time in writing PYQs again. Okay. So what is the basis? ये कैसे हुआ? Ma'am, although over and ERP heteronym कैसे measure होता है? In the previous question it was written. It A and luminal B. KI67 less than 14% in luminal A and more than 14% in E. E for medullary, M, E for metaplastic. These will come in triple negative. What will come? To be the most dangerous. So these are the set of symptoms. And obviously, I'm temporal, matlab temporal artery and giant. Next, what is the treatment? The treatment is that you have to start with steroids. That you have to start with steroids. ASAP. Do not wait for anything. So coming back to the question, is it continuous? No, it is nodular involvement. Patchy nodular involvement. Is it a small arthritis? Of course not. It is a large vessel arthritis or large vessel vasculitis. So now asking you, under large vessel you have T and P. Temporal ho gaya. If now they just change the age, giant ki bajaye they say patient is less than 50 years. Pulse is very, very weak. Less than 50 years with weak upper impulse, and you know your answer will become Takayasu. Usme of headache, fever, and pain in the upper extremities with use of some medication for 3 weeks. Okay, there's a suspicion of autoimmune vasculitis and arteriograph Which of the following conditions is associated with the vasculitis of the histopathology shown below? I assume everyone has guessed that this is a blood vessel, and in this blood vessel, you have something which is showing you as a pink color band, which is our general path, that is fibrinoid necrosis. Many of you are right. Fibrinoid necrosis and blood vessel, matlab the disease is polyarthritis nodosa, and 30% cases of polyarthritis nodosa are HBV. Which antigen of HBV will be found over here is your question from micro. तीन antigens होते हैं ना, surface, core and pre-core. So that is going to be the surface antigen which is going to be found over here. ठीक है? So HBs AG is going to be positive, not the other antigens of HBV that you find. So now when you said polyarthritis nodosa, what vasculitis is it? It is a kind of a medium vessel vasculitis. All of you know the mnemonic pan khata bacha, right? So pan, khata and bacha. Tell me that one point quickly in a minute how you will differentiate. Man, pan ka polyarthritis nodosa ka you've already told me viral marker is hepatitis B surface antigen. Most common vessel is the kidney. But does glomerulonephritis happen? No, never ever. Kidney involved होगा, glomerulonephritis नहीं होगा तो क्या होगा? Who will tell me this? Glomerulonephritis नहीं हुआ, but then what happened? I hope you remember we had a mnemonic called flea-bitten kidney. We hate PSM. I will be teaching you today. So we hate PSM. Mein P is polyarthritis nodosa. It shows you flea-bitten kidney. What is the vessel spared? So ma'am, P is not for P. So pulmonary vessel is not going to be affected. Necrosis we have already seen. This is a case of fibrinoid necrosis. So this is also settled. Now Kawasaki, I think no one will ever have a problem because Kawasaki's strawberry tongue appearance and no one forgets. Extra question kya aega? They will ask you latest update. Which antibody is found in Kawasaki disease? It is the anti-endothelial cell antibody. This is something they will be asking you. I think this is the potential exam question for this time. Kawasaki is anti-endothelial cell and body. Don't miss out on this point at all. Okay, this was your last year's PY2 FMG and NEET. Burgers disease. Ma'am, as soon as you say Burgers, B for Burgers, B for BD or any kind of cigarette smoking, they ask you the other name. It is thromboangiitis obliterans. Very good. TAO. And thromboangiitis obliterans, ma'am, itis, obliterans, itis, angiitis, blood vessels, artery affected, vein affected, nerve also affected. What is never affected is going to be your lymphatics. Very, very good. Dr. Zishan is saying, ma'am, scarlet fever also shows you strawberry tongue. हाँ, जो topics I feel you have सबने सुन के they studied it so many times. Those I'm kind of skipping because everyone knows that other than Kawasaki, this is also seen in scarlet fever. Okay, now coming back, Berger's disease, other name is asked. They ask you lymphatics never involved, and it's for treatment पूछेंगे. There is no drug that you have to give. The only treatment that you have in this case is going to be stop smoking. That's it, smoking cessation. So now answer a question on the basis of this. A man who was admitted with complaints of pain in the lower limbs and blackening to gangrene भी शुरू हो चुका है. There is a very strong history of smoking that is present. Otherwise, if you see, anti-nuclear antibodies are not there. Biopsy is shown, and you know the answer is which of the following would never be affected. So I just told you that smoking आया, but in the exam, guys, remember right now we are doing blood vessel chapter to सबका था कि बहुत ज्यादा lymphatics never affected. But in the exam, you will not know this is the concept of blood vessel. You will have to look at the picture. They will say that there is something biopsy that has been shown. Tell me, is it looking like a blood vessel? नहीं लग रहा, ma'am. Blood vessel gone, पूरा filled. That is what you're studying. Blood vessel is obliterated from the meningitis obliterans. This is not looking like a blood vessel. Is that okay? So lymphatic channels would never be affected because this is Berger's. I'm reminding you one last time. This Berger's that we are doing is the U wala Berger's because that is what is vasculitis. After half an hour, I will teach you one bina U wala Berger's. That will be the Berger's in kidney. Very good. So the one Dr. Vaishnavi, nahi, the Berger's with U is this. By mistake. So Berger's U wala is B wala. Without the U is going to be IgA nephropathy. Okay, let's move forward to the next question. Lengthy question, but I think we'll be able to get it. 23-year-old man presents with complaints of nasal obstruction, serosanguinous discharge, cough with bloody sputum over 1 month. Chest X-ray shows cavitatory lesions. There are nodules in the lung means. Then there are obviously involvement of sinuses. Urine analysis shows you kidney involvement. क्या क्या involved हुआ? Kidney involved हुआ है मैम, lungs involved हुआ है, and nose has been affected over here. Along with that, elevated C ANCA. Before I get going to anything else, I want to show you. I know everyone has given me an answer of vaginals. I'll come back to this question. The most important thing in the exam will be ANCA, and ये आजकल का most potential expected question है. Listen to this very carefully for 2 minutes, okay? When I say ANCA, it is anti-neutrophil cytoplasmic antibody. Ma'am, you are testing for an antibody. पहला point.
ये डॉक्टर्स हैं वो लोग ना ऐसे अच्छे से बोलो मैं अच्छा हूँ। मैं अच्छा हूँ। अच्छे से बोलो मैं अच्छा हूँ। अच्छे से बोलो साहिल मामा।
facts about it. So in vaginals you see both, but World Cup, so you will know in vaginals you see more of C ANCA. All the other diseases show you P ANCA, including the three blood vessel problems, including ulcerative Crohn's and primary sclerosing cholangitis. Okay, with this, now coming back, we are not done with the question yet, ma'am. Why was this vaginous granulomatosis? Because let's be honest, photo हमें नहीं समझ में आया, and I know you will not understand it in the exam also. So please note, whenever you get a question on vaginous granulomatosis, you are going to focus on two things. You will focus on two triads. ये ढूंढना exam में, everyone. Ma'am, granulomatosis, GR, where are the granulomas seen? Number one chapter blood vessel. Number two chapter is going to be lungs, and number three is going to be kidney. Okay. So remember, it is blood vessel, lungs, as well as kidneys. One more thing, you will find one more triad, which we call as ENT triad. Who will thanks for me, ma'am? Number one is going to be E, ears में क्या होता है? Otitis media. N for nasal septal perforation, nasal septal perforation. And what happens in the throat? Not the throat, but the mouth. There is going to be excellent. There is going to be strawberry. Mouth में क्या होगा? Gums होंगे, ma'am. So strawberry gums. Now you will say, ma'am, I am always confused with this. Nothing to be confused. ये वाले photo पे you didn't have to focus only. Every photo is not to give you a hint. Sometimes photos are to deviate you from the topic. If you had not even got this photo and you would have read it, so ma'am, could you see the first triad? Is there involvement of blood vessels? Of course, there is some involvement of blood vessels because patient is having anemia, bleeding, so blood vessel involved. Is there involvement of kidney? Of course, hematuria. Is there involvement of lungs? Of course, there are nodules in lungs. Triad बन गया, blood vessel, kidney, lungs. It is vaginous. ENT में क्या दिख रहा है, ma'am? I can see nasal obstruction, so some amount of nose involvement is also happening. And कुछ भी नहीं समझ में आया तो C ANCA. There is only one disease with C ANCA, and that is CPR. Ma'am, World Cup के लिए CPR, which happened to us in the last World Cup also when we lost in the finals. So World Cup के लिए we needed CPR. मतलब vaginous granulomatosis के लिए C ANCA. C ANCA का दूसरा नाम PRP ANCA. All of you will remember this. World Cup हमने देखा था finals. Unfortunately, we lost. We needed a CPR. So World Cup CPR. So for those, I hope all of you who were saying कि ma'am अगर vaginals पे question आया and I have to select one, I have said it 1,000,000 times. If you have to select one, World Cup is going to be your one answer. Sorry for getting back some bad memories, but we will move forward from these memories. Now we will ask you a question which is away from vasculitis. Okay, which is the most likely diagnosis where a skin biopsy of a painful red lesion on the dorsal surface of the hands reveals round regular cells with connective tissue and branching vascular spaces? Okay, Dr. Dhruv. You wrote in P ANCA as well. Exactly. I don't know ये confusion कहाँ हो रहा है, क्यों हो रहा है. I'm not understanding. Vaginous बार I am saying 10th time. Vaginous shows you both P ANCA and C ANCA. I will write it once again so that there is no confusion. Vaginous shows you both P ANCA as well as C ANCA. So if you have an answer of both, please select both. If you have to select one, then World Cup best. One answer select करना हुआ तो CI का. Now no confusion. Okay, now let's go back to a question which is very hardcore. I would call it pathology. Answer meanwhile I was getting angiosarcoma and glomus tumor. Okay, firstly, ma'am, there are two hints over here. I can see there is dorsal surface of hand, one hint, and second, very, very painful. Now, firstly, lipoma. Lipoma is a fatty tumor, and fatty tumor can happen everywhere in the body, but fatty tumors are usually not painful. They are just incidental findings. कोई problem नहीं है. Dermatofibroma is not something you will get on the dorsal surface of the hand. Angiosarcoma, and anyway, एक और चीज पढ़ो, vascular spaces लिखा था मैम, you have to focus on blood vessel problem. Derma, fibro, कुछ blood vessel नहीं है. Angiosarcoma is a blood vessel problem, but does it happen on the hand? No. Angiosarcoma, which organ does it happen into? Angiosarcoma, it can happen on the skin, but one organ that it occurs is liver. General path question: which are the three chemicals that cause angiosarcoma of the liver? Quickly let me know. One is going to be vinyl chloride, second one is going to be arsenic, and third one is going to be Phorodust. Remember, we have studied in our RR B18 chemicals, angiosarcoma, liver occurs. Ma'am, over here, the only answer fitting it is glomus tumor. Glomus tumor occurs on the dorsum of the hand, especially which part of the dorsal surface of the hand? It tends to occur on the nail bed. मतलब it is going to be subungual. And second point, it is going to be very, very, very painful. मतलब यहाँ पर तो सिर्फ painful लिखा था. Patient comes to you saying excruciatingly painful. Patient will be shouting with pain. These two things written, it has to be a case of glomus tumor. Now you will tell me what is the origin. Another surgery question that I'm asking you. What is the thermorregulation is what they want should happen. So remember, for thermorregulation, they have God has given you these kind of bodies. ये simple हो गया. This glomus tumor and वो ear वाला glomus. is what they want should happen. So remember, veins being to anastomos over here because they want it to happen. They want you to regulate your temperature. Thermoregulation is what they want should happen. So remember, for thermoregulation, they have God has given you these kind of bodies. ये simple हो गया. This glomus tumor and वो ear वाला glomus tumor are not the same. One very important point in case you did not know. अलग अलग. This is nail वाला, that is ear वाला, not the same at all. Okay, now let me move to the next question. The organ changes. And everything. Pregnancy glomus? No, Dr. Ananya, glomus tumor doesn't have to happen necessarily in pregnancy. Pregnancy tumor is different, that is pyogenic granuloma, and glomus tumor is different. It can coexist, but not the clinching point for diagnosis. Okay, 70-year-old male brought to the emergency department by paramedics due to chest pain for 30. Patient has a history of advanced pancreatic cancer for the last 6 months. ECG shows wall MI and measures were taken, but patient did not survive. मतलब autopsy हुआ, autopsy पे vegetations आए along the mitral valve leaflets. These are the 4 options that you have. What are you going to select out of these? Yes. Option C, everyone is selecting. क्या diagnosis बनाया? Because over here, ma'am, MI can happen because of any kind of vegetation. But over here, there is one hint given that is pancreatic cancer. You guys forgot that hint. Pancreatic cancer, and still you made rheumatoid and infected. Okay, so I'm still waiting. Pancreatic cancer, let me teach you. These are the 4 vegetations. This everyone knows. These are the 4 kinds of endocarditis that you have.